Good morning, Bahamas. I'm Mercedes Demerit, Senior Manager of Domestic Communication at the Bahamas Ministry of Tourism and Aviation, and your moderator for today's presentation. A warm welcome to members of the media, our tourism colleagues across the globe, and to all of you joining us. Today, also joining us via Zoom, we have three very special guests, two of which are senior members of the Executive Committee at the Bahamas Ministry of Tourism. Minister, the Honorable Dionisio de Aguilar, Director General, Ms. Joy Gibberlew, along with Deputy Chief Medical Officer, Dr. DeLon Brennan. We will be hearing from Minister, and once his presentation is complete, we will open the floor to questions from the media. In his report today, Minister de Aguilar will share with us updates related to entry requirements into the country and current island statuses as we move to a November 1st reopening. Without further ado, Minister, the Honorable Dionisio de Aguilar.
Thank you, Rise, and good morning, Bahamas. I want to start my remarks this morning with a definitive statement. Effective tomorrow, Sunday, the 1st of November, 2020, the Bahamas will be removing the mandatory 14-day quarantine as promised. Foreign visitors will be welcome to our country, to stay at our hotels, to go to our beaches, to enjoy some of our world-famous excursions and activities, and most importantly, to abide by our health and safety protocols. As such, the emergency orders will be revised to reflect that change. I repeat, effective tomorrow, Sunday, the 1st of November, 2020, the Bahamas will be removing the mandatory 14-day quarantine as promised, and the emergency orders will be revised to reflect that change. When we closed our borders back in March to protect against the coronavirus, never did we imagine that 7 months later, the impact of the virus would remain so severe. As a country, we have encountered much hardship from this deadly coronavirus. We have made many sacrifices, have faced huge financial hardship, endured ever-increasing emotional and mental stress, have juggled roles and responsibilities both personally and professionally, and have had to exponentially change our lifestyles. This has not been easy. Sadly, as we all know, the COVID-19 pandemic continues to have a devastating impact on global tourism. The latest data from the World Tourism Organization shows that international tourism is down a whopping 70%. Put another way, if we used to get 7.2 million tourists a year, as we did just last year in 2019, the best we can expect right now is 2.2 million tourists a year, a reduction of a staggering 5 million tourists, assuming we all do our part to prevent, diminish, stop further community spread of this deadly virus by wearing our masks, social distancing, and not congregating in groups, both large and small. What's more, the World Travel and Tourism Council just released new research indicating that 174 million travel and tourism jobs could be lost in 2020 if global travel restrictions remain in place. Here in the Bahamas, we are seeing and living this data firsthand. Tourism is the heart of our economy and accounts for 50% of our entire GDP and 65% of our employment. We must safely reopen and restart our tourism sector so that we as a nation can begin to recover. I firmly believe that together, and with the support and participation from every single member of our community, we can move the needle from survive to thrive. We've proven before that we can do this when faced with unthinkable circumstances, such as this once-in-a-century pandemic. And I have every confidence that we can do it once again. But it takes all of us, every single one of us, doing our part. Even though we are here today to talk about a reopening, the facts on the ground are that our country has been open to international travel for many months now. Persons have always been free to leave the Bahamas without any restrictions, and a number of airlines, JetBlue, Air Canada, and more recently American, have been bringing in travelers, mostly returning residents and citizens, using an extremely reduced schedule. Late last month, the Ministry of Tourism started the process of contemplating how to jumpstart our tourism sector, given the near total shutdown of the sector since mid-March. The process was driven by necessity, with government revenues down by hundreds of millions of dollars, with tens of thousands of Bahamians out of work and suffering the indignity of not being able to support themselves and their families through employment in the tourism sector. The status quo is simply unacceptable. And that status quo is the mandatory 14-day quarantine, which made our destination extremely unattractive to prospective travelers. As you can imagine, nobody wants to vacation in a destination where you are restricted to a single hotel for your entire stay, unless that hotel has significant facilities or is all-inclusive, allowing you to vacation in place. To remove the mandatory 14-day quarantine, the Ministry of Tourism engaged in lengthy consultations with the Ministry of Health. And I'm delighted to have with us this morning from the Ministry of Health, the Deputy Chief Medical Officer, Dr. DeLon Brennan, who will be available for questions during the question and answer period at the end of my formal presentation. At first, we contemplated replacing the mandatory 14-day quarantine with a series of tests, namely a rapid antigen test on arrival and a rapid antigen test 5 days after arrival, if the traveler was still in country at that time. As you can imagine, the logistics and complexities of rolling out any type of testing in a country with as many islands and as a consequence, as many ports of entry as we have in the Bahamas is no small undertaking. As the Ministry of Tourism fleshed out that idea of testing at the border and began to roll it out with the huge support of the Immigration Department, NAD, the Airport Authority, the Grand Bahama Airport Company, marina operators, local healthcare providers, and other interested parties in the private sector, the guidance from the Ministry of Health changed. The use of rapid antigen tests as an effective screening tool at the border was not supported by the available research, or as some would like to say, was not supported by the science. As a result, effective tomorrow, the 1st of November 2020, there will be no tests conducted on arrival. I repeat, effective tomorrow, the 1st of November 2020, there will be no tests conducted on arrival. The test on your 5th day, however, will remain in place if you are still in country. Travelers will enter the Bahamas as they have always done, with their Bahamas Health Travel Visa and their accompanying PCR tests conducted within 5 days prior to arrival, have their temperature checked at the airport and other screening deemed necessary by the public health officials, and proceed to their final destinations in the Bahamas. As there will no longer be any requirement to quarantine, there will be no requirement to enroll in the Hubcat monitoring system, nor go through the time-consuming process of downloading that app. Travel restrictions are having a detrimental effect on global tourism, as evidenced by the data I referenced earlier. The Ministry of Tourism has been working with our airline, hotel, and other tourism partners to strike a balance between heeding the advice of the health professionals to protect the health and well-being of the country and develop protocols that make the Bahamas a more desirable destination for travelers in the era of COVID. Whilst the policies themselves may have changed, the overarching mandate to promote the health and safety of both Bahamians and visitors has not. The Ministry of Tourism, alongside a spirited partnership with the Ministry of Health, has left no stone unturned ahead of this November 1st reopening. Whereas past efforts to reopen have been constrained by strict but necessary requirements, this new process is more comprehensive, more methodical, and more accommodating towards the shared vision of a healthy, safe reopening of the tourism industry. These new streamlined entry protocols will additionally simplify traveling for both visitors and residents. As of tomorrow, November the 1st, all persons entering the Bahamas must still obtain a negative COVID-19 RT-PCR test taken no more than 5 days prior to the date of arrival. Children 10 years and under, as well as pilots and crew of commercial airlines who remain overnight in the Bahamas, continue to be exempted from this requirement. Your negative PCR test results must then be uploaded in order to complete a Bahamas Health Travel Visa application, as well as be presented to immigration upon arrival for validation that the date of the test is within the 5-day requirement. For these reasons, I would suggest that everybody entering the Bahamas print out a physical copy of one's negative PCR test results to prevent against technological issues arising during travel, and not allowing you the ability to access the results online. Any person with test results outside of the 5-day window will be denied entry into the Bahamas. Once in possession of a negative COVID-19 RT-PCR test, travelers can then apply for their travel health visa at travel.gov.bs. I would strongly encourage persons to apply immediately after receiving their negative test results, as the applications can take a few hours to be manually reviewed and approved. This time may increase with the expected influx of visitors as our visitor numbers start to pick up again. So plan accordingly. We do understand that it is not easy to secure a PCR test and get it approved within the 5-day window, but the screeners at the Ministry of Tourism will be vigilant in ensuring a quick turnaround. The Bahamas Health Travel Visa has been in operation since June, and we are right now in the process of upgrading that platform. The Bahamas was one of the first countries in the Caribbean to require a health visa, and now every tourist accepting country across the region requires one. In addition to capturing your personal data and your PCR test results, the health visa will also be used as a tool to determine your current health status. Health officials are always quick to say that while testing is a vital tool in this fight against coronavirus, constant self-evaluation of one's health status is an equally important tool to determine where our risks lie. The visa will have questions that the traveler will be expected to truthfully answer that will alert us to their current health condition and allow us to individually assess the risk each potential traveler poses on the health and safety of our islands. Not a replacement for, but rather a complement to the required RT-PCR test and an additional layer of protection in our complete defense against COVID-19. As of tomorrow, November the 1st, travelers will be required to pay an application fee for their travel health visa. Additionally, as of November the 14th, all visitors to the Bahamas will be required to purchase COVID-19 health insurance before they come to the Bahamas. The cost of this mandatory health insurance will be automatically included in the total cost of the health visa. The inclusion of the travel health visa is to ensure that any visitor who may test positive for the coronavirus while on vacation in the Bahamas or become ill from the virus while in the Bahamas will not suddenly become a burden to an already overburdened Bahamian public health system. This insurance is not intended for Bahamians, as they will be returning home, and we expect them to avail themselves of our local healthcare providers and our local medical facilities in the usual manner. I'm pleased, therefore, to say that no visitor who tests positive will pose a strain on our healthcare facilities. The influx of arriving passengers will not jeopardize the availability of health resources, hospital beds, or COVID-19 testing capabilities for any Bahamian. Atlantic Medical, now known as CG Atlantic, has been contracted to fulfill this new mandatory requirement that each visitor coming to the Bahamas be in possession of specific COVID travel health insurance. In the case where a visitor tests positive, 3 comprehensive options are available to that visitor, none of which will burden our existing health infrastructure. First, those who test positive but exhibit no symptoms, i.e. asymptomatic, can quarantine in place for up to 14 days. The insurance will cover the hotel costs of that quarantine. Second, if a person tests positive, exhibits no symptoms, asymptomatic, but has a pre-existing medical condition, then they will have the option to be medically evacuated out of the country. And third, if a person tests positive and exhibits symptoms, they will be immediately medically evacuated to their home country for medical purposes. This policy will be enforced in the next 14 days and will be enforced throughout the entire Commonwealth of the Bahamas. The cost of this insurance will be billed to the visitor through the introduction of a fee for the travel health visa. In fact, all costs associated with administering the health protocols of travelers entering the country will be recouped through this new fee for the travel health visa. Therefore, citizens and returning residents, alongside visitors staying up to 4 nights, will be charged $40. Visitors staying more than 4 nights will be charged $60. Even though it's on your screen, I'll repeat it again. Citizens and returning residents, alongside visitors staying up to 4 nights, will be charged $40. Visitors staying more than 4 nights will be charged $60. Children 10 years and under will not be charged. Given that the 14-day mandatory quarantine will be removed, visitors will no longer be required to vacation in place for 14 days. Visitors will be able to move about and enjoy the amenities of their hotel, the beach, and excursions, so long as all health protocols are followed and enforced. To ensure effective daily monitoring of symptoms, visitors will soon be required to complete a daily online health questionnaire that will be sent to them every day of their visit using the email provided when they applied for the health visa. This screening tool will involve a series of questions which, if answered truthfully, will allow an automatic assessment to be conducted and, if necessary, an immediate referral to screeners for further follow-up and evaluation. Any visitor who displays COVID-19 symptoms during their stay, either through the self-reporting mechanism of a hotel or through a Ministry of Health evaluation, will be required to take a rapid antigen test and receive a negative result in order to continue with their vacation. Those who test positive will be required to then take an RT-PCR swab test. And if they test positive with that, they will be handed over to Atlantic Medical to take advantage of one of the 3 options already outlined in the insurance policy. All visitors and returning citizens and residents staying in the Bahamas for longer than 4 nights will be required to take an additional rapid antigen test, a quick, easy procedure with results provided electronically via text message and an email within the hour. The cost of this test will be included in the cost of the health visa. The location of where this test can be administered will be provided on the Bahamas Health Travel Visa website. In Nassau, it will be any doctor's hospital location. In the Family Islands, obviously each island will have a different option. When you receive your Bahamas Health Travel Visa, it will possess a QR code, which is like a barcode. When you present for the 5-day test, that QR code will be scanned by the screener so that the results of your test can be properly uploaded to your account. Naturally, we encourage everyone to take the 5-day test so that we can assess your status 5 days after entering the Bahamas. We also encourage you to take the test since you will have already paid for it, and there may be a small fine if you do not. I again remind all Bahamians that exhaustive procedures are in place for all travelers entering the Bahamas. Positive test results and any issues that arise in the online screening process will be reported to the Ministry of Health surveillance team, who will conduct additional surveillance investigations as per their own mandates. The benefit of this technological platform of the travel health visa is that the surveillance unit will be notified immediately, and any positive test or any concern that arises from the screening tool. This allows the on-island experience to remain practically unchanged. Face masks and appropriate physical distancing remain required whenever in public settings, and visitors are reminded to abide by all protocols as outlined in the most recent emergency power orders. The Ministry of Tourism strongly advises all visitors and returning residents to review the interactive Know Before You Go map on the Ministry of Tourism's website to determine what travel restrictions, if any, are currently in place on a particular island ahead of travel. The new dashboard breaks out our 700 islands into our now familiar 16 different destinations. In those 16 different island groupings, you will clearly see what you can and cannot do and what restrictions are in place. Right now, restrictions exist for the Abacos, Grand Bahama, and New Providence. In regard to these 3 islands that are under curfews and implementing greater public health restrictions, travelers will be required to follow the orders accordingly. In the case of curfew, those guests at hotels and resorts will be required to stay within the property grounds during curfew hours. This dashboard will be updated accordingly as new emergency powers are announced. The number 1 reason why foreign visitors come to the Bahamas is to go to the beach. So it is vital that if we are going to kickstart our tourism sector, get persons back to work in our hotels and other tourism-related activities, that tourists be allowed to come to the Bahamas and go to the beach and go for a swim. The Prime Minister announced earlier in the week that beaches will now be open. Hotels that are adjacent to or connected to beaches will now be able to apply to the competent authority for an exemption to any restrictions to beach access that may be in place. When our foreign visitors come to the Bahamas, there is also overwhelming interest in fishing, diving, and other water-based excursions. As such, these water-based excursions, as well as water taxis, will be able to resume operations once they implement and abide by the necessary rigorous health protocols. Ladies and gentlemen, our research reveals that there is significant pent-up demand for a Caribbean vacation. We can tap into that demand if visitors have assurances the rules governing their prospective vacation remain relatively stable. While we understand that we will be living with COVID for some time to come, and there may be the need for changes, we must take the necessary steps to ensure that the Bahamas remains an attractive destination for persons willing to take a vacation. We must all seek to limit community spread. We must all seek to abide by the health protocols, and we must ensure that once in country, the visitor will be able to enjoy a relaxing, stress-free holiday. After all, that is why they come here, and it is because of their decision to come here that proud Bahamians will be able to go back to work and feed their families. I would like to commend both the Ministries of Tourism and Health for their efforts in creating, fine-tuning, and then implementing this process that will see the safe reopening of our tourism sector on November the 1st. It is indeed proven a national undertaking. I thank you for your time. With me here today is the Director General of Tourism, Mrs. Joy Jibralou, and as mentioned, the Deputy Chief Medical Officer, Dr. Dawn Brennan. I now open the floor to questions from the press.
Thank you, Minister, for that very robust update. I'd like to bring on Mr. Kyle Joaquin, our news. Can we have your first question, please?
Sure. Hi, Mr. Merritt. The first question is for the minister. I apologize for the extended question. It's kind of long. But I note the change in plans to no longer test upon arrival, but still test if they stay beyond 4 days. But there has been a lot of concern regarding what some may call the VIP treatment for visitors when compared to locals, particularly with government urging Bahamians to traveling abroad to do so with, quote, enough money, but facilitating things like per diem for visitors who may test positive and be asymptomatic while they're here. Just for clarification, if they're allowed to vacation in place if asymptomatic, how does that affect them utilizing restaurants and amenities on property that will require them interacting with locals? Is there some special coverage for these employees? And as far as the traveler's insurance for visitors goes, I may have missed this, but can you clarify the actual cost of the insurance coverage each visitor will be paying? And if the Bahamas government is paying a portion or putting any part of the bill in any stage of this insurance coverage?
Minister? Minister?
Minister is on mute.
Sorry about that. Very long question, and I will answer the second question first as it relates to the cost of the insurance. Embedded in the fee for the Bahamas Health Travel Visa is a cost for the insurance. So in answer to your question, the traveler will pay 100% of the cost of the premium, and the Bahamian people and the Bahamian government will not pay 1 penny of that premium. What was your first question again?
Can we have your first question, please?
I mean, all that was the first question, but I just wanted to know, in terms of visitors, with them being asymptomatic, what happens? How do you control, with them interacting with locals? You say they can vacation in place. Even perhaps what happens, will government fine them if they do not be retested once they're here?
So as it relates to, obviously there is always a concern that the visitors will transmit the virus to us and we will transmit the virus to them. So we are really focused on the transmission of the virus from them to us. So they have to get the PCR test on arrival 5 days before arrival, which is no small undertaking, and they will come and go to their hotel. We are encouraging all of our hotels to put in place a screening tool so that they can test their staff as well. I think it would be very unrealistic to assume that they'll be able to get away with not testing their staff. So we're encouraging them using private sector options to implement a screening and testing protocol for their staff so that those staff can be tested and screened and not, first of all, transmit the virus from us to them, and also, as we've seen in a number of businesses and government offices, when you have an outbreak, it leads to the shutdown of that particular facility, making it difficult for, if you have a restaurant and you have an outbreak in that restaurant, to allow that to operate. So that is what we are suggesting to certainly our hotel operators.
Okay, I have another question. There has been little to no talk about what's going to happen with domestic tourism. You have people who would like to visit family islands without the 14-day quarantine period, just as the tourists enjoy the liberty coming from abroad. Any word, particularly for those looking to travel from New Providence to the family islands?
So very good question, and we've had lots of questions about domestic tourism. So what we've decided to do is, bearing in mind that this is an enormous undertaking, we've really been focused on international travelers. And certainly within the next 7 days, we're going to turn our focus and the building of the necessary platform to deal with domestic travel. Bahamians want to travel to our family of islands, but we understand that within New Providence, which is the starting point for many travels into the family islands, we are experiencing a certain level of community spread. So the government is concerned about how to roll that out. So we've turned our focus to international travel, and this week we will turn our focus to domestic travel. And who knows, maybe 1 week from there, I'll be back here talking about that and how that's going to roll out. But we want to crawl before we walk, before we run.
Thank you. Next up, we have Ms. Janelle Longley, Eyewitness News. May we have your first question, please?
Good morning. My first question is about tourists who will be traveling to the family islands. It's pretty hard now to get immediate airlift out of those islands. So how will we plan to facilitate visitors in a timely fashion without extending exposures and risk?
Minister, this one is for you.
So obviously, as demand grows, the necessary airlift will move into place to take care of that. I think you've probably seen very limited airlift because there's been just very limited business. And so as we seek to, as we see the numbers begin to grow and the demand for inter-island travel begin to increase, so too will we see the necessary airlift coming into place. It's same in the international market. We have a very reduced schedule into the country right now. Very few planes are coming in. But as they see demand increase, they are prepared to put the airlift back in place. And I think even this month, based on this announcement today, a number of airlines will be resuming service. I don't know, Director General, if you want to add to that.
Good morning, and thank you very much. In addition to adding to it, Minister, and to also add to the answer that you provided, Ms. Longley, if I can say that for the time being, people who want to get to a family island have an opportunity to fly into New Providence, and they will be allowed to make a transfer. So that was always contemplated because we know that that's the primary way that people actually can get to the family islands. And there is an interest in the family islands. So just to let you know that that option also exists. And in terms of increase, we see that American Airlines, in fact, is talking about bringing airlift back to Exuma. And as Minister rightly said, this notice will now begin the conversation for those airlines who do want to return services, particularly to our family islands, where that is a clear interest because of the beaches and the ability to self-isolate.
Thank you. May we have your second question, please?
Okay, thank you. And my second question is about the demand. I know the minister said earlier that Caribbean tourism destinations are of demand right now. Are we seeing positive results as we head into the holiday season, Thanksgiving and Christmas, or is it still a bit too early to tell?
Director General.
Thank you. This is a question that has come up on numerous occasions. What has happened is that we have actually held off on marketing to the extent that we would need to get going, to get the tourism engine going once again. And the reason being, obviously, putting the necessary protocols in place that met the requirements of our Ministry of Health and for the government. Also being able now that we're in a position to communicate that these protocols, we are now in a position to begin the marketing. It will be a lot easier to begin that marketing once the US elections have conclude next week, but we know that there is interest. The market intelligence, the data continues to show an interest in the region. And if we look at the Dominican Republic and Mexico, where there have been an easing of restrictions, and certainly Jamaica as well, we can see that over time, in fact, throughout the Caribbean, over time, the demand has continued to build up, and we expect to be in that same position.
Thank you, DG. Next, we have Ms. Cleopatra Murphy from ZNS. Ms. Murphy, can we have your first question?
Good morning. The US has seen a significant surge in COVID-19 cases over the last week, and yesterday would have broken the world record with 99,000, more than 99,000 cases reported. Now we have the country removing the 14-day quarantine and opting instead to conduct follow-up rapid antigen tests on the 5th day. What provisions do we have in place to ensure that these tests do occur and that these tourists are indeed tracked? We have Mr. Diaglo just saying just now that he's encouraging tourists to take the test, but we also know the country was challenged before in terms of contact tracing. So how do we intend to truly track these people and police this?
Minister?
Yeah, okay, thank you, excellent question. First and foremost, you're absolutely right. The number of cases is surging in the United States and surging in Europe. But I think we have to operate under the premise that whether there's one case, 10,000 cases, 100,000 cases, whatever the number is, we have to operate and assume that every contact that you come into contact with, every person you come into contact with could potentially be positive. And that's why all of the necessary protocols that are advised by the public health officials are so important. You'll see certainly frontline persons wearing face shields. You'll see barriers in place, people wearing gloves. I just think it's very important, no matter what the number is, whether it's 1, 10,000, 100,000, it's very, very important that everybody take the necessary precautions to ensure that they keep themselves safe and they don't get themselves exposed to the virus. What was the second part of your question?
That was the first question. Our second question. Can we have your second question, please, Ms. Murphy?
Okay, my second question is, the ministry would have recently just launched the BEATS program. Can you say what level of interest has there been in that program so far? Have you gotten any? And are people clamoring to work or study in the Bahamas right now, particularly when we still have these restrictions in place? I know the minister mentioned that hotels can apply for certain concessions for their guests, but what about persons who won't be staying at hotels?
Director General?
Yes, you're right. This past week, Ministry of Tourism did launch the BEATS program, the Bahamas Extended Travel Stay program. And this allows people to come to the destination for up to 1 year, either to work, and that is doing independent work that they can do remotely, or to study. And the study portion of it is in partnership with the University of the Bahamas. It is noted that this program is something that has come out of the Economic Recovery Committee, one of their recommendations, and it was something that definitely Ministry of Tourism has seen value in, and we're marketing it. I actually have been surprised from the point of view that even before it was launched, Ministry of Tourism had communication from particularly second home owners who heard about the program even before it was launched and expressed an interest in how do they apply, because they would really enjoy coming to the Bahamas, having the opportunity to stay in a home that they already own and stay for up to a year. And so certainly immediately that showed and demonstrated that there would be that level of interest. As you rightly said, that was recently launched, and I confirm just this week, we will be marketing that in earnest. There has been great interest, certainly from an international media standpoint, and we see those other destinations where a similar program is in place, that there is interest in it. But the advantage of the Bahamas, of course, is our proximity and the ease to get here. So we anticipate that that might be a really good value added to what we already have to promote and market.
Thank you. Ms. Sasha Lightburn, RTV, can we have your first question, please?
Good morning to all tourism officials, definitely the Minister of Tourism, the Director General of Tourism, and Dr. Brennan, who's also on the call. My first question is with reference to the travel visa website. If a person is experiencing issues with the website, as with technology, we often experience glitches. Where can that person call or email? There is no help button. There is no question mark button on the website. So where can a person go if they are experiencing issues with the site for the travel visa? And does that travel visa site also apply to domestic travel?
Minister?
So first of all, we are in the process of transitioning from the old website to the new website. As with every transitioning process, it has its glitches, and for that I apologize. Unfortunately, what happens is when we decide to update or upgrade our IT platforms, generally we're given very, very short time periods to do it, and we just don't have sufficient time to robustly test them before taking them live. And given the fact that we're charging for the visa and we've made some changes and we're going to do this test after arrival, we needed to make some changes to the website. So I will instruct them to put onto that website right now where you can reach out if you're having technical difficulties, because you're absolutely right. It's not pleasant to be stuck in a IT circle and not be able to reach someone to try and help you and guide you through the process. So we are aware of that. It'll probably be a bit bumpy for the next couple of days, but as with all of these website upgrades, we expect by the end of the week it should be flowing smoothly. Every day we're updating, and as people bring things to our attention, we are making those changes. It's not ideal to test a website by taking it live, but unfortunately, that is what we did. But we will definitely put the necessary help features on that website to assist persons who are experiencing difficulties. Just so you know, that website is actually managed by the Ministry of Tourism. It's run by an excellent team, and they are very responsive and turn around things exceedingly quickly. So we will be very happy to help you.
Thank you. Ms. Lightburn, may we have your second question?
If I just may, with all due respect, Minister, in the interim, if persons are experiencing problems, is there a number that they can call or an email address that they can maybe, that the ministry can maybe give out so that people experiencing problems can have that number and maybe email address? And this is a follow-up to that question, sorry.
No problem. I'll allow the DG to respond because I don't have that at my fingertips.
Okay, if I can provide that number and an email address, the telephone number, 242-502-0829, 502-0829, and the email address, healthvisa@bahamas.com, healthvisa@bahamas.com.
Thank you. Ms. Lightburn, your second question?
Thank you so much for answering my follow-up, Madam DG. My second question, and this is directed to either the minister himself or the Director General. Wouldn't it not be safe to post a medical official to some of the larger resorts throughout the country, just in case there is a problem? We know a large amount of our remote islands have lesser to none medical facilities on them. So would it not be safe to maybe at this point, especially moving closer towards the Thanksgiving and Christmas period, to have a medical professional on staff on each island in the major resorts where we know maybe the numbers are going to be larger or bigger than some, to help mitigate the spread of this virus from those who are particularly coming from the United States, where my colleague said, their numbers are great.
I'll let the deputy CMO answer that question.
Good afternoon. So our major challenge with that is just having the number of healthcare staff that would be available to do so. As one might imagine, our healthcare staff is currently active in all of our islands, both our more populous islands as well as our remote islands. They're actually actively delivering care and dealing with the COVID-19 pandemic on the front line. So to have someone then assigned full-time to these properties would take people out of being able to deliver frontline care in that instance, and we just don't have the human resource capital to be able to do so. So in that instance, we push for, advocate for, almost mandate that these protocols for making sure that persons are screened appropriately according to the recommendations of the Ministry of Health and our international partners. And that once we know that the travelers are asymptomatic and they are known to be negative before arrival, we know we have contact with them, because in their application process we have their email address, we have their cell phone numbers, they indicate where they are going to stay, and so because we have so much information on them, if it does become an issue, we need to contact them, then we have that information to do so. And if they need to contact us, that information is provided as well. So we make sure there is a conduit for that contact and the protections to go along with it, where if they were to have symptoms or something were to develop, we have a backup protocol for them to be evaluated, within a clinical arena. And then if need be, if they do have symptoms that are consistent with COVID-19 and they then test positive, they would be able to be moved into the appropriate place, whether in country or, as the health insurance would allow, out of country.
If I can just add, if you would permit me, to what the DCMO has indicated. It should be noted that our large hotels actually do have medical facilities, and in many instances, the larger hotels already have a doctor on staff, but certainly nurses and highly trained staff on staff. So if we look at Exuma, for example, even the larger resorts there also have it. So to add that to what has already been stated by DCMO, Dr. Brenner.
Thank you. Thank you, DG. Next up, we have Ms. Tyler Simonet, JCN. May we have your first question?
Good morning to the minister, his team, and to all who are listening. My first question is, what exactly is the ministry doing to assess the tourist RT-PCR tests? We will have tourists bringing tests from many different hospitals, many different clinics. How will the ministry ensure that tourists are bringing fraudulent negative COVID-19 tests and in turn possibly exposing locals when they arrive in the country?
Excellent question. Since I worked in that unit myself for a couple of days, I'm probably in the best position to answer that. When a test is uploaded by a prospective traveler, whether they be Bahamian or not, there's 4 things that we look for on that test. Is it the right test with the right result within the right time period from the right lab? So in answer to your question, when you've looked at these results a million times, you get familiar with what a lab result looks like from a particular lab. And if you haven't heard of the lab, there's a way that you can go online and search to see if that lab is properly accredited. So there are agencies and organizations in the United States, like the CDC, that accredit a particular lab. And once you know the name of the lab and the address of that lab, you put in the zip code of where that lab is, or put in the identifying number of that lab, and you can go and see if that lab is accredited. So we feel very confident that we have that process down pat. And we feel very confident that every test that is submitted to us is screened for checking those 4 items that I mentioned. Most of the tests come out of the United States, of course. And when you get out of the United States, go to Canada, Europe, it becomes a little less precise, but we have mechanisms by which we can check to see if the lab is accredited and that they are not falsifying that document.
Thank you, Minister. Ms. Simonet, your second question, please.
Actually, if I could just get a follow-up to that, because if we see a large influx of tests, do we have enough manpower to screen every single tourist that is coming through? If I could just get some clarity on that part.
Oh, absolutely. We have a very robust team that have been doing this now for 3 or 4 months, and they're very efficient. We know exactly, by and large, how many tests that they can do on a daily basis. We also know who is coming when they're arriving, so we make sure that we process the tests of those persons that are coming first. So yeah, the Ministry of Tourism has built a very robust team. Obviously, it was a bit bumpy getting started, but now we're very familiar with that process. I feel very confident that that process is covered.
Thank you.
Okay, thank you so much for that response. My second question now is, Minister Diagler, you stated that tourists will not test upon arrival anymore, but they will have to test if they stay for longer than 5 days in the country. Could you explain the rationale behind this again? Because there are concerns that tourists may get tested on Monday, go out and be exposed on Tuesday, and have their flight to the Bahamas on Wednesday. That will give these particular tourists a few days to walk around on our islands before being tested again. And as medical professionals have said, 70% of positive COVID-19 cases are asymptomatic. So if you could just bring some clarity as to why tourists will not have to test upon arrival.
So I'm going to hand that over to the Deputy CMO. That's definitely within his wicket, and let him respond to you.
Sure. So thank you for the question. I think using your exact same example, if you mention the fact that if someone were to be exposed on Tuesday or exposed on Monday, travel on Tuesday and not have a test done, if they did have a test done at that time, they wouldn't show up as positive anyway. So it really wouldn't give you the type of results you're looking for. So the reason you don't test, everybody when they immediately after they get exposed is because they have to go through their incubation period, which can be anywhere from usually the average is about 5 to 6 days before persons will actually start showing symptoms, and they can start shedding maybe a day or two before that, but they're not going to start having signs or symptoms immediately anyway. So the reason you want to make sure people have that test, that real-time PCR test prior to arrival, is because you want to screen out as much of those individuals who might be positive and already shedding virus at that time. To implement, another test, whether rapid antigen or real-time PCR, immediately for an asymptomatic individual, it won't give you a yield on results that you're really looking for. If you're going to, what you really need to do is allow persons to actually have or go through that incubation period. And so if they go through their incubation period and get to a point where they are shedding virus, whether symptomatic or asymptomatic, that would be the ideal time when you want to go about testing them. And like I said before, the average amount of time that takes is about 5 to 6 days, and thus why testing everyone on arrival doesn't give you the type of results that you would think it would, as opposed to actually giving time for persons to go through an incubation period, assuming that they've actually been exposed. Do remember that the reason the international organizations like a World Health Organization or Pan American Health Organization actually advise against doing screening, doing testing for the traveling public is because those are asymptomatic individuals. And for you to test asymptomatic individuals, it uses resources that you could actually be putting toward symptomatic individuals. And because that is a low prevalence population, it doesn't give you enough of a burden of disease to really start picking up as many people as you want. So you're going to have a reduced sensitivity and specificity mostly sensitivity for your test results, and you are then going to now decrease the possibility that you're picking up who you want to and telling the right people that they're negative when you want to. So it is a lot to have to deal with, but realistically, it doesn't give you the types of results you think you would be getting by doing testing on arrival.
Thank you. We have Ms. Tanya Cartwright from the Tribune. May we have your first question?
Good morning. It's Tanya Smith Cartwright. My first question is for the minister, kind of piggybacking on the question you had just now. You know, we've scrapped the antigen test. I thought we were going in that direction for tourist arrival. Some 15-second result test that you swish around in your mouth and you have the results sent to your phone right away, keeping the lines moving. Now we know couple of months ago, PAHO said that the reason why we're seeing our spike is because we reopened our borders too soon, etc. Does this put us back in the same situation we were in? Because I mean, as the young lady said, if you have a test that you're supposed to take within 5 days of traveling, you could contract that the day before or the day before, you know. So does this put us back to where we were? Anyone coming in can have this thing.
I don't think so, but I'll let Dr. Brennan answer that question because that's medically related again.
Sure. So again, someone, just as we were noting in the previous answer, if someone was to be exposed immediately before they travel to the Bahamas, testing them on arrival isn't going to reveal whether they were going to test positive or negative or not. And so what you end up with is this false sense of security because that person is going to test negative, but you are then saying, okay, well, they tested negative, so now they don't have to adhere to protocols. They can just go about and giving people, that negative result says, hey, you're safe. And then you can do, they then take that to mean they have these liberties to do anything they wanted to. That's not the position you want to put people in. You really want to tell people that they have to adhere to these protocols. They must do the social distancing, they must do the sanitization, they must wear their masks. And that is what you want to reiterate. That is what is going to help us out in this situation. The issue around the rapid antigen testing, which just note that it wasn't a saliva test. The rapid antigen test is a nasopharyngeal swab, much like the real-time PCR is at present, the one that we are using. So you would still have to do the nasopharyngeal swab, but as was mentioned, that test is meant to be done in symptomatic individuals. So you're supposed to use that test to say if these persons are symptomatic, so that is a high prevalence population, those are people who are already exhibiting symptoms that are consistent with COVID-19, you use your rapid antigen testing in that population when you don't have easy access to real-time PCR tests available to you, or any delay would then not allow you to put people into the right category of these people have symptoms, they're positive, so we need to put them in isolation. These people have symptoms, they are negative, so it is unlikely that that person has COVID. They may have some other respiratory infection, but it's not COVID-19, and you're able to do that quickly so that you isolate the right people, and then you move other people out of your system that you don't necessarily need to use all the robust infrastructure you put in for COVID-19. So that test is specifically for that purpose. It is not meant to be used in a low prevalence population, such as asymptomatic individuals or the traveling public.
Thank you. Ms. Smith Cartwright, can we have your second question, please?
Could I have a little follow-up for that one? Just a quick one from the minister. Just wanted to know if this is not our desperate attempt to get tourism off and running. Is it a little risky, do you think?
Well, obviously we've had consultation with the health professionals, and we feel that we are adopting a safe process. You know, I looked throughout the Caribbean, and I looked at a total of 20 destinations. And of those 20 destinations, only 3 were testing on arrival. So obviously, this is not something that has gained traction. This is not something that's been generally accepted. And so if everybody is not doing it, There must be some reason why they're not doing it, and they're not doing it because the science doesn't support us doing it. So that's why we're not doing it. So, we can only go with the science. We have a very robust public health public health department. We're guided by them. And that's why I punted all of those questions to them, because that's who we punt them to, and we have the same questions as you.
Thank you. Ms. Smith Cartwright, do you have a second question?
Yes, my second question is very quick, and I know that at some point the Director General might have touched on this, but I don't recall a number. I just want to find out exact figure of tourists that's expected next week, or an approximate figure, whatever figure.
I actually can't give that figure to you now. We would have an approximate number, but I don't expect those numbers to be considerably more than they have been. Although having said that, we know yesterday alone, our travel health unit approved 1,000 applicants for the week of the 1st of November. So they've had a very busy day, and that is even including the challenges that we've been experiencing. So while we don't expect these numbers to be particularly anywhere near they would have been, even at the beginning of this year, we can look at those numbers at the end of November, looking towards Thanksgiving and coming up to Christmas. And I think it would be great to track where we are now and how we ramp up and how we are ramping up. We need to continue to restore confidence in the market. We need to show that we are committed to the path that we're on. Our airline partners, our travel and tour agents, that's what they're looking for. Desperately want to promote, but want clear, concise rules, regulations, not confusing. And then once we have demonstrated that, I think you're going to see that our numbers will begin to pick up in the direction that we wish them to.
Thank you, DG. Next, we have Ms. Jasper Ward, the Nassau Guardian. May we have your first question?
Good morning. So in a letter obtained by the Nassau Guardian to Minister D'Aguilar, I think it was on October 29th, I see your smile, Minister, Living with COVID Coalition Chairman Mr. Robert Myers said that the government's decision to eliminate point of entry testing for individuals traveling to the Bahamas, and I quote, seems to introduce a larger risk of community spread following the reopening of our tourism sector. Can I get a response to that, Minister?
Yeah, my response is that I will hand you over to the health officials, and they will respond to it. I mean, it's a technical question about an opinion on the position, whether our protocols are robust enough. So I am not technically able to answer that question, and Dr. Brennan, I'm sure, would be happy to answer it.
Sure. So thanks again. I think our protocols are definitely robust in that this is a system that conforms with what the science is behind it, but also gives us the approach that allows us to do something to follow up with individuals to find out, are they having symptoms or not, and then build in the backup to go along with it for taking care of them if they do become ill. So in this instance, remember, individuals are going to, again, test before they come to the jurisdiction. So you've already mitigated a significant amount of that risk prior to them even coming. When they come into the jurisdiction, again, you have all of their information, you have their contact details, you know where they're going to be. Then a risk assessment is done on them on a daily basis. So they get the information, they get a questionnaire, they fill that out. For those who are in a lodging where, like a hotel, there are medical professionals on site. We give them the information of who they can contact if they have symptoms. But again, we are initiating a contact with those individuals every day and getting information back for them. Any red flags that come up in the system, then we would then respond in the usual manner that we would in order to follow up with them as well. So with the recommendations of the international organizations out there and the scientific bodies out there that say, for an asymptomatic population, what you really need to have in place is the ability for them to know what's in your system, for you to be able to contact them, and then if they are symptomatic, have a plan in place as to what you are going to do with them if they were to have symptoms. Then that is what, you know, all the bodies recommend. And so that is what the system has now put in place. We're saying we will have a contact for them. They will be able to contact us. We will initiate the dialogue between us. And then if there are any issues, we have an approach to how they can be evaluated. And if they are positive and are exhibiting symptoms, then they can be moved to their home country without placing additional burden on our healthcare infrastructure in country. So I think that is a robust system and one that we want to make sure that we continue to support with the capacities that we do have in country.
Thank you, Ms. Ward.
All right, second question. Let's go back to those rapid antigen COVID-19 tests. Minister, you would have noted, I think, in your presentation that they aren't really useful in testing asymptomatic individuals. I know Dr. Jessica Edwards, a microbiologist at PMH during a Ministry of Health and OPM press conference last week, would have also indicated that those tests aren't very effective in testing asymptomatic individuals. Can you say what the rationale behind using COVID-19 tests is on the fifth day, and what is being done to ensure that asymptomatic visitors are not actually spreading the virus while they are here?
So I know you really want me to speak on this matter, but it's really out of my remit. So I will hand you back over to Dr. Brennan because it's full squarely in his remit.
Sure. So what we are trying to do, and I mentioned it during this same press conference as well, is that the rapid antigen test is mostly to be used in individuals who are displaying symptoms that are consistent with COVID-19. And so that is where you get the biggest bang for your buck. It is a higher prevalence population. And so you want to use it in that instance because it does give you the advantage of getting results a lot sooner. And then you are able to then make decisions a lot faster and being able to triage people into one category or another. So there just isn't a robust amount of evidence out there in asymptomatic individuals. So we have long shown that we have not had issues in country with a high pre-test probability of testing within the traveling public, because most of them do not have symptoms, along with the fact that those who were, when we did quote unquote open the sector in July, those persons, again, all of the visitors were tested prior to their travel. And so you had a level of sense of security when you knew that those persons at least had some form of testing that was done before them coming into the country. What we really want to do is establish what the utility is of using those rapid antigen tests in that population. And so if we look on a day 5, if you're thinking, again, with the same thought process that someone may have been infected in between the time of them traveling to the country and their actual arrival in country, then you want them to go through some time period for them to then start exhibiting symptoms. And so you can use, there's a thought process in the scientific literature that you may be able to use the rapid antigen testing as a surveillance tool, and then be able to build a base of evidence as to whether in that population you would then be able to start picking up some of those. So it is not to say that we know for sure that at day 5 we are going to run into a lot of people who are likely to have disease. That is a very unlikely scenario, because those persons are seemingly asymptomatic. But what you want to do is try to figure out what the utility is. So it's trying to figure out, could we use it in this instance? And therefore piloting it for use at that time would give us some data by which to say, does it provide us with some protection and some utility? So I think it's more of, we are trying to figure out how we could go about using this rather than saying this is the absolute use for it. And we need to build that scientific evidence to go along with it. And so we are participating in building our surveillance activities. And this is one way we could build some of that capacity as well.
Notario McKinsey, eyewitness.
What I would, just before you go on, Risse, what I would say is that when we did open back in July, our contact traces confirmed that certainly from foreign visitors, only 1% of the transmission resulted from them. So we don't consider them to be the high risk group. Obviously, and what is different now between July and now is that we're requiring everybody to get a test, and we're also getting everybody to apply for a visa to come home. And so the government is certainly not trying to encourage travel by our citizens. We want our citizens to remain in place and not to travel. So, you know, getting the PCR test in the States is going to take you anywhere from three to 4 days to get it. And then there's a certain cost associated with it. And there's obviously a cost associated with the health visa. So we're confident, hopeful, making our decision based on science, not on emotion, that we will be able to keep our numbers in check and certainly not contribute, mitigate, I think is the correct word, mitigate as much as possible the importation of the coronavirus through the travel of the opening of the tourism sector. Okay, on to your next question, Rosa.
Thank you. Mr. Notario McKenzie, eyewitness, can we have your first question, please?
Good day, all. Thank you. My first question for the minister, I know you mentioned just seconds ago that the government is trying to discourage locals from traveling or to remain in place. I guess as an extension to that, what is happening with Bahamas Air? Is Bahamas Air going to be operating on its international routes, or will it be grounded in that respect?
Minister?
Great question. Thank you so much. Bahamas Air will continue on its international routes. We have made no decision to change the grounding of its international routes. There, as we all know, there's very little business right now, and we even in our domestic flight schedule, there was very little demand. So we are not at this present time looking to restart that international travel. Certainly in the short term, we'll certainly revisit it, notwithstanding the fact that it's costing us an absolute fortune to keep the airline on the ground. So a lot of these other airlines are operating in the United States because they're receiving enormous subsidies from the US government. So we don't want to start the airline and exacerbate the problem of actually making the losses greater than they are now. But we're constantly reassessing that.
Thank you. Your second question, Mr. McKenzie?
Thank you, Minister. And again, this may be a bit off the topic, but I was just wondering, that's the airline. Has there been any recent conversations with the cruise lines and how these various COVID protocols will be implemented with them? I know you had mentioned previously that their first choice would likely be their private islands. Just was wondering if there's been any recent conversation with the cruise lines.
Absolutely. We've been meeting with the cruise lines one-on-one. Myself, someone in our cruise department at the Ministry of Tourism, and actually Dr. DeLon Brennan has been involved in that process to review their protocols. Obviously, the enormous stumbling block for cruise companies is getting CDC approval to restart sailing. And I was just informed yesterday that the CDC has actually provided a pathway to resuming a sailing. There are lots of rules and regulations, lots of steps to fulfill, lots of hoops to jump through. But rather than saying we're not even considering it, they have now provided a pathway for cruise companies to restart cruises. So we're very excited about that. It's a small step, but a big step. And obviously, I said before that this is going to be a process. They will probably start off cruising from Miami to their private island with their staff, just to check things out. Then they'll move from that to their customers going from Miami or Florida or wherever to their private island. then they will come to Nassau and probably go on pre-arranged and pre-screened and pre-vetted tours. And then the final step will be, okay, we can move into the general public. A condition of that, however, is that we get our community spread numbers in check. So this is why it's so important for us to all contribute to this, because if our numbers continue to persistently be high, and we've noticed that they're trending down, but to persistently be high, this will make it difficult to resume that very important and very crucial part of our tourism revenue stream.
Thank you, Minister. Thank you all for your questions. This concludes our presentation today. Details shared on our tourism protocols can be found on bahamas.com/travel updates. Thank you for tuning in.